When replacing a missing tooth, it always starts with the same thing. What does the patient want? And the patient always wants the strongest, best replacement that they can possibly get. And a lot of times the best option is a dental implant. All dental implants require excellent bone to be successful long term. So that's the main goal of the implant consultation, is determine the quality of the bone. We take a series of diagnostic measurements, including a 3D X-ray, and also sometimes digital measurements, including impressions and photographs. Once we determine that a patient is a candidate for a dental implant, my main mantra in every implant case is no surprises. And the way we have no surprises is we actually digitally plan the case in its entirety before we ever touch the patient. If the tooth that's missing is in the aesthetic area at all, any of the front 6 or sometimes front 8 teeth, we always provide some kind of restoration so you have something in place that you can smile and function with. During the procedure, we utilize a variety of comfortable techniques, including buffered local anesthetics, which takes a lot of the sting out of the initial injection, because you will be very numb when you have your implant placed, which makes it very, very comfortable procedure. Most patients afterwards say that the discomfort is mild to moderate discomfort, sometimes no discomfort afterwards. Healing takes approximately 3 months before we bring you back in to place the final crown. During that appointment, we take all our digital measurements so our dental laboratory can build a beautiful zirconia restoration on top of the implant that's going to fit and feel perfect.